My name is Amy Herman. I am president of the Art of Perception, president and founder of the Art of Perception. I'm thrilled to be the speaker for the upcoming hematology conference, and what I plan to talk about is how I use art as the data to reconsider our observation, perception, and communication skills. And my program started in medicine, so it's not just about rethinking and reconsidering those skills as they relate to patients, but how do we talk about our findings with our colleagues and with patients' families and with the medical community at large. I not only talk about how do we define observation, perception, and inference, but I'm also going to show people how much we're missing. And how do we talk about what's not there? Everybody worries about, am I a good communicator about talking about what is there and what the problem is, but we don't often think about talking about what's not there. So I'm really excited to explore with this group how we can use works of art to talk about what we see, what we perceive, what we assume, and also what isn't there. I'm going to be using art as data not only to reconsider our observation, perception, and communication skills, but I also want us to think about biases, assumptions, and inferences that we might make. The other thing that I'm looking forward to working with this group on is talking about what's not there. We always focus on being clear and concise and objective about what we see, but how do we talk about what's missing? And I think that'll be very interesting in hematology because we're often talking about cases and patients and comparative studies, but how do we talk about the omissions and what's not there? So there are a couple reasons it's important to me. I'm a very visual person, and I love looking at art, but I also love looking at the world around me. And I find that with our use of digital technology, which will never go away, we have to use our digital technology creatively, people don't look up. And there's a tangible lack of engagement in the world. And in medicine, you have to rely on technology, and that grows every day, but we can't lose our connection to humanity and to people. And as a cancer survivor myself, I know the important role of working with the entire medical profession in healing, from diagnosis all the way through treatment to healing, how important engagement is. So it's about balancing our use of technology and really learning to rely on our own observations and perceptions. Well, I think in the field of oncology and hematology, we're always dealing with data, and we're dealing with trends, and it's a very visual world. Medicine in itself is a very visual world, and what we have to remember is behind every disease is a person. So we're not just looking at a person as a set of symptoms, we're looking at them as a whole person. So I think thinking about the big picture and the small details, the data as they relate to people as individuals, is a reason that this could really resonate with these physicians. That's one of the things I love about working in the medical field is I get to work with whole teams. I work with doctors and nurses and social workers and administrators. And it's all about patient-centered care, providing the best level of care, safe, compassionate, and effective patient care. And what my program does, because it's not substantively a medical program, it puts everyone on the same playing field when it comes to effective communication. And I've also found that people in medicine already have good observation and perception skills. That's not the problem. The problem is in the effective communication of what it is that we observe. So I want these teams, these really effective teams, I want to help them make them more effective. I can't teach them how to do the work they do, but I can teach them how to be more effective at the work that they do. One of the foundations of my program is that no two people see anything the same way. So that goes for professionals as well. So I want to open up the lines of communication. If two medical professionals don't necessarily agree, I want them to feel comfortable to say, you know, I don't see it that way. Can you tell me how you got there? Because this is what I see as the more viable form of treatment. And to bring in one other level, sometimes doctors, nurses, social workers, other medical professionals will know something about the family or about the extended family or the circumstances that, while they may not relate exactly to diagnosis, they can have a very big role in how the patient is going to heal. And I want to open up all those lines of communication and make sure that all that information is on the table to provide the best holistic care for the patient. I get something out of every one of my sessions. Because I have the privilege of working across the professional spectrum, I always like to debrief with my audience and find out what are the short-term and long-term applications of this program. How do you see yourself using the skills that we talk about in the session? And so each of those sessions informs further sessions. So I can tell hematologists and oncologists how ER doctors reacted to something, or how intelligence analysts reacted to something. And quite selfishly, multiple perspectives make for better decision making, and that goes for me as well. So the more perspectives I get looking at these works of art, the better decisions I'm going to make, and hopefully tailor my presentation to be as applicable as possible.